Spina bifida is a birth defect in which the spinal cord and spine are not completely formed before birth, also known as myelomengicell. Normally, during the first month of pregnancy, the two sides of the spine join together to cover the spinal cord, spinal nerves, and the meninges. Spina bifida refers to any birth defect involving incomplete closure of the spine. The causes of spina bifida are largely unknown, though some evidence suggests that genes may play a huge role, but in most cases there is no familial connection. A high fever during pregnancy may increase a woman's chances of having a baby with spina bifida. Women with epilepsy who have taken a drug to control seizures may also have an increased risk of having a baby with spina bifida as well. There are two forms of spina bifida. There's spina bifida occulta, which is the mildest form of spina bifida, and occulta means hidden, meaning that the defect is covered by the skin and not open. Most children with this type of condition never have health problems, and the spinal cord is often unaffected. The other type of spina bifida is spina bifida manifesta, which also includes two types of spina bifida, which is mengicell and myelomengicell. Mengicell involves the meninges, the membranes responsible for covering and protecting the brain and spinal cord. Myelomengicell is the most severe form of spina bifida, and it occurs when the meninges push through the hole in the back, and the spinal cord also pushes through. Some symptoms of spina bifida: loss of bladder or bowel control, partial or complete lack of sensation, partial or complete paralysis in the legs, weakness of the hips, legs, or feet of a newborn, and other symptoms may include abnormal feet or legs such as club foot. Certain treatments for spina bifida, genetic counseling may be recommended. In some cases where a severe defect is detected early in the pregnancy, a therapeutic abortion may be considered. After birth, surgery to repair the defect is usually recommended at an early age. Before surgery, the infant must be handled carefully to reduce damage to the exposed spinal cord. This may include special care and positioning, protective devices, and changes in the methods of handling, feeding, and bathing. Also, antibiotics may be used to treat or prevent infections such as meningitis or urinary tract infections. Most children will require lifelong treatment for problems that result from damage to the spinal cord and spinal nerves. This can include gentle downward pressure over the bladder, which may help drain the bladder. In severe cases, drainage tubes called catheters may be needed. Orthopedic or physical therapy may be needed to treat musculoskeletal symptoms. Braces may be needed for muscle and joint problems. And lastly, neurological losses are treated according to the type and severity of function loss. And that is spina bifida.